Hello, welcome to all at one. In this video we will see red blood cell disorders, anemia, its type, and the second we will see is polycythemia. Anemia means deficiency of hemoglobin in the blood. Can be caused by either too few red blood cells or too little hemoglobin in the cells. Some types of anemia and their physiologic causes are the following. 1. Blood loss anemia. After rapid hemorrhage, the body replaces the fluid portion of the plasma in 1 to 3 days. But this leaves a low concentration of red blood cells. If a second hemorrhage does not occur, the red blood cell concentration usually returns to normal within 3 to 6 weeks. In chronic blood loss, a person frequently cannot absorb enough iron from the intestines to form hemoglobin as rapidly as it is lost. Red cells that are much smaller than normal and have too little hemoglobin inside them are then produced. Gives rise to microcytic, hypochromic anemia. 2. Aplastic anemia. Bone marrow aplasia means lack of functioning bone marrow. A person exposed to high-dose radiation or chemotherapy for cancer treatment can damage stem cells of the bone marrow, followed in a few weeks by anemia. Likewise, high doses of certain toxic chemicals, such as insecticides or benzene in gasoline, may cause the same effect. In autoimmune disorders, such as lupus erythematosus, the immune system begins attacking healthy cells such as bone marrow stem cells, which may lead to aplastic anemia. The third is megaloblastic anemia. Loss of vitamin B12, folic acid, and intrinsic factor from the stomach mucosa can lead to slow reproduction of erythroblasts in the bone marrow. As a result, the red cells grow too large, with odd shapes, and are called megaloblasts. Atrophy of the stomach mucosa, as occurs in pernicious anemia, or loss of the entire stomach after surgical total gastrectomy can lead to megaloblastic anemia. Also, patients who have intestinal sprue, in which folic acid and vitamin B12 are poorly absorbed, often develop megaloblastic anemia. Red cells that are formed are mostly oversized, have bizarre shapes, and have fragile membranes. These cells rupture easily, leaving the person in dire need of an adequate number of red cells. 4th, hemolytic anemia. Caused by different abnormalities of the red blood cells, many of which are hereditarily acquired. These abnormalities make the cells fragile, so they rupture easily as they go through the capillaries, especially through the spleen. The number of red blood cells formed may be normal, or even much greater. The lifespan of the fragile red cell is so short that the cells are destroyed faster than they can be formed and serious anemia results. One type of hemolytic anemia is hereditary spherocytosis, in which the red cells are very small and spherical rather than being biconcave discs. These cells cannot withstand compression forces because they do not have the normal loose membrane structure of the biconcave discs. On passing through the splenic pulp and some other tight vascular beds, they are easily ruptured by even slight compression. The second type is sickle cell anemia. In this type of anemia, the cells have an abnormal type of hemoglobin called hemoglobin S, containing faulty beta chains in the hemoglobin molecule. When this hemoglobin is exposed to low concentrations of oxygen, it precipitates into long crystals inside the red blood cell. These crystals elongate the cell and give it the appearance of a sickle rather than a biconcave disc. The precipitated hemoglobin also damages the cell membrane, so the cells become highly fragile, leading to serious anemia. Such patients frequently experience a vicious circle of events called a sickle cell disease crisis. Here, low oxygen tension in the tissues causes sickling, which leads to ruptured red cells. This causes a further decrease in oxygen tension and still more sickling and red cell destruction. Once the process starts, it progresses rapidly, eventuating in a serious decrease within a few hours and, in some cases, death. The third type of hemolytic anemia is erythroblastosis fetalis. Rh-positive red blood cells in the fetus are attacked by antibodies from an Rh-negative mother. These antibodies make the Rh-positive cells fragile, leading to rapid rupture and causing the child to be born with serious anemia. The second thing is polycythemia. It is abnormal increase in erythrocytes. It has two types. The first is polycythemia vera or erythrema. Red blood cell count may be 7 to 8 million/mm³. The hematocrit may be 60 to 70% instead of the normal 40 to 45%. caused by a genetic aberration in the hemocytoblastic cells that produce the blood cells. The blast cells no longer stop producing red cells when too many cells are already present. This causes excess production of red blood cells. The total blood volume also increases to almost twice normal. As a result, the entire vascular system becomes intensely engorged, at stress. The viscosity of the blood in polycythemia vera sometimes increases from the normal blood 3 times. And 10 times viscosity of water. Secondary polycythemia. The blood-forming organs automatically produce large quantities of extra red blood cells. Occurs when tissues become hypoxic because of too little oxygen in the breathed air, such as at high altitudes, or because of failure of oxygen delivery to the tissues, such as in cardiac failure. This condition is called secondary polycythemia. The red cell count commonly rises to 6 to 7 million/mm³, about 30% above normal. A common type of secondary polycythemia, called physiologic polycythemia, occurs in natives who live at altitudes of 14,000 to 17,000 feet, where the atmospheric oxygen is very low. The blood count allows these people to perform reasonably high levels of continuous work even in a rarefied atmosphere.